Welcome to the Psychology World podcast. I'm Connor Whiteley, bringing you psychology news, articles, and other interesting psychology-related articles. Where I can find the podcast notes and more interesting psychology-related things, and you can get your free 8 psychology book box set at connorwhiteley.net. Now let's get on to the show. Hi everyone, and welcome to episode 150 of the Psychology World podcast with me, Connor Whiteley. And today's episode is on what are the mental health benefits and disadvantages for marijuana use. So I thought this would be a really interesting podcast episode today. I'd like to celebrate that we're halfway to episode 200. I really am looking forward to though. And it is Friday the 13th of May 2022 as I record this. So we're moving on to the psychology news section. We're reading from the British Psychological Society Research Digest, and there's some quite funny ones here today. For example, the first one. Why phrases like rowdy bows and moose ooze seems funnier. Which is the funnier? Large small or moose ooze? And there are 2 more examples, but I can't do them on the podcast because they're slightly ruder. That, and I don't want the podcast to be labelled as explicit because then it gets banned from tons of countries automatically. If you went for the second each time, you'll be in a good company. In a new study, participants gave words of parents in the second set the highest humour rating, whilst those in the first languished near the bottom. One very obvious difference is that those in the second set reference sex or bodily secretions, whilst the others don't. But Cynthia OQC at the National University of Singapore, along with Thomas Edgar and Thomas T. Hills at the University of Warwick, also identified broader factors at play. In their paper in the Journal of Experimental Psychology, Learning, Memory and Cognition, they argued that these factors explain why a gangster pastor, for example, is a funnier than insulting nickname. Interesting. So yes, it would be nicer to actually show you with the other 2 examples. But again, I don't really want to risk the podcast just for the sake of 2 examples. But the psychology of humour is always really interesting to study though, not only as a person, but also as a writer too though. So it's actually quite interesting to see. But the next one I do like. Well, it's not so much that I like it, but I find it interesting. Women candidates are seen as less electable, which makes voters less likely to support them. Politics in the UK is becoming increasingly diverse, but there's still a ways to go. When it comes to gender, the portion of women in the House of Commons is at an all-time high, but at 35% it's still far from representative of the population. A new study published in PNAS looks at barriers to women being elected, and the Stanford University team finds even voters who would prefer a female candidate show a level of pragmatic bias. If they believe that women candidates face barriers, that makes them less electable, and they are less likely to vote for them. Okay, now this is quite interesting because personally, I prefer female candidates though, because I just really feel that sometimes we need women candidates just to shake up politics though, because women have their own experiences, backgrounds, opinions, etc., which might help actually shake up politics a bit more. So interesting, and it is a shame because I do like female political candidates. And the final one is, here's how actors differ in their ability to read their own bodily signs. How is it that some people can slip into another character so perfectly that they can win applause while the rest of us struggle to act at all? Good actors have to convey a range of emotions, and one way that we feel and control our emotions is by tuning into bodily signals, such as the more rapid heartbeat that comes with excitement, fear or joy. So reasoned Peter Omshaw at the University of Denver, and really apologise, I've just butchered the name, and her colleagues. Perhaps actions are better at sensing these signals, a process known as interoception. So, but there's not a lot of I can actually say about this psychology news article, because actors, to be honest though, I think that because it's easier said than done than when it comes tuning in bodily signals though, because that does take a training though, so it's just something to bear in mind and to be aware of. So that's enough psychology news section, so let's move on to the personal update. So we're moving on to the personal update. So this week I've been very busy doing different bits and pieces there. For example, I've been working up on finishing the literature review, and thankfully that's done now. And I'm not actually going to go into too much depth about that because, as I've mentioned before, part of my psychology coursework is to write the reflective diary, and that's what I'm actually going into depth, reflecting on this, and actually offering tons of people tips that I'm sort of writing as a book that will be released next year. So if you're interested in placement news, work experience, and just general tips, then definitely check that out. But it was interesting to work on the psychology graphs, the literature summary tables, which I actually never heard of before doing this project, and that's what I really like actually doing this placement, because I get to learn about tons of new stuff that they don't necessarily teach you in lectures. But aside from that, it was my birthday weekend last week. Some I got to spend tons of time with family and friends. Some we went act a phone. There was a escape room, but I think there was too many people there, to be honest. And it actually wasn't that good compared to one that I did with my university lot in December last year. But it was still a nice birthday present. And then on Sunday, it was a massive family barbecue that sounds really a good weekend all around. And as always, I always love to hear your thoughts and feelings on today's episode. So you can always email me, connorwhiteley@connorwhiteley.net. You can always leave a comment at the show notes at connorwhiteley.net/podcast. And you can always tweet me on Twitter at sci-fi whiteley. I always love to hear from all of you because it really helps make the podcast feel more like a conversation. And today's episode has been sponsored by Normal Psychology, the Causes and Treatments of Depression, Anxiety and More, 3rd edition. So this is such a brilliant book for today's episode, though, because marijuana, it's a drug that has a tons of benefits and disadvantages, to be honest, mainly disadvantages on our behaviour, from our cognition to our biology. So this is really important to actually understand that. So the reason why this is a great, really easy to understand book is a good sponsor for today's episode is because it actually features a drug section though. It actually teaches us how do other drugs affect our behaviour though, and then it also focuses on depression, anxiety, and schizophrenia though. So it goes through all of the different courses of those additions. This is a really interesting book. Even if you're not that interested in the drug use. So there's Abnormal Psychology, the Causes and Treatments of Depression, Anxiety and More, 3rd edition, available from all major ebook retailers, and you can get the paperback and the hardback version from Amazon at your local bookstore and local library if you request it. So that's enough for the personal update. Let's move on to the content part of today's episode. So we're moving on to the content part of today's episode. So we're going to be talking about what are the mental health pros and cons of marijuana use. And because it's a really good introduction, in my opinion, I'm actually just going to dive straight into it. So with the increasing legislation of marijuana across the world, it raises a lot of important questions that haven't been answered for mental health professionals and psychologists. Also, given the very lax attitude in my experience of university security guards towards marijuana, it is a very popular choice amongst younger people. This only adds to the concern from psychologists and health professionals. Also, I should mention that in addition to marijuana use that being legal in Canada and other places in the United States, marijuana use for medical reasons is illegal in 36 states, and using it for recreational use is legal in 18. However, this does raise an awful amount of questions from psychologists, as we all will try to find our way through these rapidly changing times through research, informed opinions and policy making. Yet despite a significant amount of recently conducted research on marijuana use and its effects, there is still a lot of unanswered questions that we need to solve before we can even begin to fully understand how to safely incorporate marijuana use into our practices and wider societies. What are the benefits of marijuana use for mental health? As much as I love the history, and especially ancient times, even though of course I would never want to live there, I have never paid too much attention to their drug use, but other people have. Therefore, since ancient times, marijuana has been used widely for its medical and euphoric effects. For example, marijuana does have a strong anti-inflammatory effects that does help pain relief. In addition, marijuana can be used to reduce nausea in cancer patients who are undergoing chemotherapy, and there is some evidence to suggest that marijuana could help those suffering from PTSD, multiple sclerosis, glaucoma, HIV/AIDS, and some forms of epilepsy. Then, just to make things even more interesting, there is some very early research that was conducted by the neuroscientist Gary Wien that suggested that marijuana could be used to help prevent memory loss in aging by reducing inflammation in the brain. Of course, because this research was done so long ago, it has to be redone with modern methods to test the findings, but still very interesting to consider. Then, in terms of psychology, some clients use it to treat insomnia, depression, and anxiety with them levels of success. Yet, it has to be noted that sometimes it completely fails, and it makes the condition a lot worse. Also, marijuana use in the over 60s has increased by 75% in the last 3 years, with many of these people using marijuana to help their chronic medical conditions and the anxiety that comes with aging. As well as marijuana's so-called ability to expand consciousness leads to smokers and to users having a better appreciation of the simple pleasures of life, like listening to music, being out in nature, and enjoying good food. Overall, I think that it's very clear that there are some potentials of marijuana use for pain management and alleviating symptoms in other conditions, yet given that there is not great certainty about it working every time, as the negatives below, I'm still not convinced. What are the negatives of marijuana use for mental health? So moving on to the negatives, I do partly wish that this was a much shorter section than the positives, but it won't be, because the negative effects are vast, and they are even worse for adolescents and young adults, like university students. Since a recent study in New Zealand found that people who started using marijuana in their early teens had longer-term memory impairments, with a lowering of IQ, poor academic and job performance, as well as a greater risk of depression later on in adulthood. Additionally, for people who had traumatic background and adverse childhood experiences, they found they had a higher risk of developing this pattern of impairments, as well as they're 4 to 7 times more likely to become dependent on marijuana, alcohol, and other drugs. Personally, I think that's simply a tragedy, and I don't want people to suffer at all with poor job performance and academic performance, and to get an increased chance of suffering from a mental health condition. Moreover, marijuana use causes an increase in positiveness, paranoia, apathy, heightened anxiety, and impaired driving skills, which is most probably because of the higher strength and potency of the HTC, which is the psychoactive component found in today's marijuana compared to the 1960s. With there being a greater risk of marijuana triggering psychosis, even in people without a genetic disposition to schizophrenia. But what about adults? Unfortunately, it doesn't get any better for adults, because all the negative side effects that occur in young adults and adolescents happen in adults too. Sure, there are some particular side effects that are more concerning in adolescents and young adults. For example, the brain still actively develops up to a person's late 20s, so using marijuana doesn't exactly help their brain health. Also, since 2019, in the United States, ER rooms have seen dramatic increases in adolescents coming in for problems when marijuana was involved. So no one is exactly sure why, but it is thought to be a combination of the rise of vaping, the stress of the COVID-19 pandemic, and the decreased perceived risk of marijuana use. Finally, there is a good amount of evidence that smoking marijuana has harmful benefits on the lungs, since it has caused an increase in bronchitis and other chronic lung conditions. A more reflective conclusion on everything. Despite the benefits and the dangers of marijuana use discussed in this episode, I should note that we know a lot about marijuana. We know that it can be effective in treating certain conditions, and we know the dosage that is best in some situations, amongst other things. However, we also know that we need a lot more research to help us stamp out some of the questions and flesh out what we already know. All this research will help us to understand what is best for people, society, and treatment as a whole. Nonetheless, it is a shame that as a society we are moving very quickly towards marijuana legalisation without knowing all the facts. Also, it's a shame that tons of people think marijuana is a lot less dangerous than alcohol, other drugs and other illegal substances, when there is a great amount of evidence suggesting it is just as dangerous. Overall, there is a lot more work to do that needs to be done, and it will be interesting to see what the future holds for marijuana use, policy making and psychotherapy as a whole. So I really hope that you enjoyed today's episode. This is definitely an episode that I've been wanting to do for a little while, because even though I've never smoked and I never will smoke it, I knew that it does happen quite a lot at universities, which at the time I was actually quite shocked about. But then I sort of realised that, oh right, so this is what some university students do. It was actually quite interesting and quite a learning experience though. So personally, I would never do it, but I did just want to see what are some of the benefits and what are some of the drawbacks. Because we can know of something, I knew there were dangers and I knew there were negatives of marijuana smoking, but I actually didn't know the nitty-gritty though. So hopefully that you really enjoyed today's episode. And if you know someone who would enjoy it, then please share it with them. I'm always really grateful when you wonderful people help spread the words about the podcast. And definitely check out Normal Psychology, the Causes and Treatments of Depression, Anxiety and More, 3rd edition, available in all the usual places. But if you didn't want to buy a book, but you still want to give the podcast a bit of one-time support, then you can now buy me a coffee at buymeacoffee.com/Connor Whiteley. So have a great day, everyone, and I'll see you next time. Thanks for listening today. I hope you enjoyed it. If you want to see the show notes, then please go to connorwhiteley.net. And if you want a free 8-book psychology box set, then please go to connorwhiteley.net. Have a great day, and I'll see you next time.